Sensationally silver, because you are.
Welcome, everyone, to Sensationally Silver, A State of Mind, conversations with extraordinary, ordinary persons of age, people who are going to bring you information, inspiration, and validation. Join us. Hi, everybody, and welcome to Sensationally Silver, A State of Mind, conversations with extraordinary, ordinary persons of age. And my extraordinary guest today is Dr. Michael Paveloff. He is an eye surgeon in Santa Barbara, and I am so grateful that he's agreed to come speak to us about issues that persons of age need to be aware of regarding their eyes. So welcome, Dr. Pavloff.
Thank you, Robin. I appreciate it. I look forward to being here.
Yeah. Okay. So let's start with your age because you have to qualify to be on this program.
Yes.
How old are you?
So I am 62.
Okay.
But that's kept a secret. But yes, from my kids and my family. But yes, I'm 62 years old.
Oh my gosh. You know, that's
just made the cut.
That's one of my questions sometimes is, have you ever lied about your age? So why is that a secret?
Lied, I would say no, maybe not disclosed all the truth. Yes. I started later in life, and so I got married later. My kids are younger. I drop them off at school. Most of the dads are all younger, so they kind of identify with them that are really more in their 50s. I feel like I've been very blessed. My mom and my dad both have very nice skin, good genetics, and so I've always looked a little bit younger, but also just always mentally, physically, emotionally felt younger than my physical age. And so I have no issue sharing it with people, but I don't often just upfront disclose it. Yes.
You don't stand on corners holding a sign.
Right. No, we're all giving it the good fight.
Well, and when I was talking to Dr. Pavloff in his office, and I was asking him what were some issues that persons of age needed to be aware of. Were there some? And he said yes. And I talked about the podcast. And I was thinking I couldn't have him as a guest because he was way too young, but we know how old he was. So that's the very good news for us. So let's start in about
yes.
What are those issues that maybe we're not aware of and we need to be?
Well, for patients of age, or for all of us really and 60 is kind of the benchmark, is there's several different things in ophthalmology. Some of the bigger issues, well, first of all, as we all get older, we should have a good understanding of what our health history is with our family. As we're knowing and doing more research and the 23andMe's, genetics plays a big role in maybe what your future is health-wise, as well as your vision. And eyes are no different. So there are markers now that people can test when they do their genetic sequencing or 23andMe. Do they have a predisposition to macular degeneration, glaucoma issues? Cataracts are pretty common for all of us as we get older. But those are the three biggest things. I think the hard part, really, Robin, for patients as we all age, is that a lot of things that can happen with the eye happen very slowly, and patients don't really notice they're having any problems unless they go to a healthcare provider or an ophthalmologist, have their eyes looked at, and we can often early diagnose problems that people will have well before they start noticing any vision issues, and then keep them from having significant vision changes or damages in the future.
So what are some of the things that can certainly at least be slowed down, if not prevented, if they're caught early enough?
Well, probably the number one, well, not probably, the number one biggest cause of vision loss in the country, as well as internationally and worldwide, is cataracts. Cataracts are the leading cause of blindness around the world. I've been working with See International for over 20 years, part of their board. I travel for them internationally, doing cataract surgery all over the world. And cataracts come from many things. One, the most common is age, which is kind of why we're here today. Look, it's cataracts. I tell patients are like getting wrinkles on our hands or our face. You can't fight it. God willing, we all live long enough. Everybody gets cataracts. And what a cataract is a clouding of our natural lens. So when we're younger, our natural lens is clear, like clear glass. As we age, and that clouding process can happen very early for patients, but for most of us who live a healthy lifestyle, that starts to happen probably in our late 50s to early 60s. It does occur very slowly, but as we get older, the lens gets kind of hazy, as if you're looking out to the world through a muddy window, in which case they start noticing more glare at night, maybe more difficulty prompts on the TV, street signs. Here in town, problem with people playing pickleball or golf or tennis, or, depth perception when you're hiking. And that process occurs very slowly. So if we can pick it up early for patients, and that's the reason for having an ophthalmic exam earlier in life, I'd say mid 50s and beyond, there's things that these patients can do to slow that progression down. What are those things? Well, sunglasses outside. You want to cut down your UV exposure. Green leafy vegetables in your diet, spinach, broccoli, asparagus, arugula, and things like that. And then I think often I'm a big fan of supplements. So patients taking a combination of lutein and zeaxanthin. These are essentially antioxidants which help maintain the health of the photoreceptors in the retina in the back of the eye, which can help slow down the progression of cataract formation. And then, of course, if they have other issues, there's other things that we can do to kind of help slow that down. It's funny, people always ask, well, are there eye drops I can take? Because you can go online and there's medications that say that can reverse cataract formation. None of these eye drops, Robin, really are effective at reversing the development of cataracts. Some of them may help slow that down. Certainly a healthy lifestyle, sunglasses, antioxidants, which also, by the way, work well as anti-aging agents for all of us, because we're all giving it the good fight to stay younger longer, and cancer fighting agents. So there's not only a health benefit to the eyes, but a health benefit to your body with things like that.
So with cataracts,
Mm-hmm.
I hope this isn't a dumb question. If you are aware of what you need to be doing and you're doing everything you can to slow that process down, does that also help the rest of the eye?
It does, because taking these precautions for the health of your eyes, again, sunglasses, green leafy vegetables, antioxidants, lutein, helps to decrease your risk of macular degeneration. Now, although cataracts are the leading cause of blindness or vision loss internationally and worldwide, within the United States, probably macular degeneration is the leading cause of vision for patients. Look, for all of us getting older, friends of mine, people in their mid 60s, 70s, all have friends, they go to the eye doctor every month, they're getting shots in the eye. These are patients who are being treated for what's called wet macular degeneration. When you have macular degeneration, this is a condition that affects the health of the deep layers. So the lens where we develop the cataract, look at that as the focusing mechanism, like a camera lens that we look through to focus on the world around us. Where we get macular degeneration is in the retina. Look at the retina as the film that's processing the images that come into the eye, right? So the cataract will impair the quality of that image coming into the eye. But if your retina is damaged, you can have a great quality of image coming in, but the retina can't process that image. And so doing these things now to help prevent cataracts will also help slow down, or help, in some cases, prevent the development of macular degeneration. Now, just to talk a little bit about that, there's two different types of macular degeneration. There's the dry type, which is the better of the two, and the wet type. Now, for many years or decades, we've had good treatments or decent treatments for the wet type, much better treatments in today's market, but not a lot of good options for the dry type. So for those patients who have macular degeneration, we often recommend all the same things that we do for cataracts, sunglasses, green leafy vegetables, but also recommend a vitamin called Preservision or MacuHealth. These are more fortified antioxidants, which help maintain the health of the photoreceptors in the retina in the back of the eye. And in doing so, Robin, help to kind of slow down the development of macular degeneration. So this is something that many patients can find out in their 40s. if they have 23andMe and gene sequencing done, because in doing so, there's a gene that increases your likelihood of developing macular degeneration, or if you have a family history of it. So if patients know at an early age, it's just like anything else. Taking precautions earlier may help prevent the development or slow that down for them. Um, if they have the dry type, there are now medications for treating that, but prevention to keep it from going from dry to wet is really the most important thing. If they have the wet type of macular degeneration, that's where I would then refer them over to a retina specialist in town. And there's different medications which are now very, very effective at treating that and slowing that process down, if not, Robin, in some cases, reversing that process.
I didn't know it could be
Yes,
reversed.
it can be. For example, my father has wet macular degeneration, and he's been getting injections every other month in his eye. So he goes in 1 month for the right eye, the next month for the left eye. And he has maintained good functional 20/40 vision for probably the last 7 or 8 years now with wet macular degeneration, right? Your mother always tells you, don't be careful, don't get a needle in your eye. It actually, in the right position, and the retina surgeons are very, very good at doing it. It's extremely safe, very effective, and the treatments in today's market are very good at slowing that process, if not reversing it. So there are treatments to be had for patients who have macular degeneration, but that in the 65 and older age group or population base is by far the most common cause of vision loss in this country. And we don't think about it, Robin, but people are living longer. They watch your podcast. They're taking care of themselves. They want to work longer. People don't retire at 63, 64, 65. I have patients in their early to mid 80s who still actively work 30, 40 hours a week. So they need to take care of their vision. They want to see better. They're seeking out cataract surgery sooner in life to maintain their vision or to have better quality of vision, but they're being treated for macular degeneration earlier because they still want to work and see better.
Yeah. It's very scary to think about losing our vision. What
Yes.
what gets in the way of people doing what they need to do to stay on top of all these things? I mean, I don't know if people are reluctant to get their eyes examined. You tell me, what do you see?
What I would say, fear of the unknown. Fear is probably the biggest reason people don't come in. Sometimes they have their eyes examined. Maybe their parents or grandparents had macular degeneration or glaucoma or even just cataracts. And they're afraid to hear that they've got something. They remember grandma or mom and dad couldn't see after 70, and they're afraid of losing their sight. So sometimes not knowing is more peaceful. But on the flip side, not knowing prevents patients from taking precautions of pursuing proper care for themselves. And so I think fear is a big reason. And other reasons, I tell people eyes are kind of like your feet. When they're not bothering you, people don't think about them. But when you have a problem, pain, discomfort, it doesn't take much, Robin. A little scratch on the cornea is debilitatingly painful for patients. So when patients are not having a problem, they don't think about their eyes. So a lot of them will go on for years and just realize, oh, I haven't seen my eye doctor. It's been 3 or 4 years. So a lot of people just don't think about it. So trying to get patients on a routine follow-up care. And so what does that mean? Let's talk about that a little bit. So, most patients, if they don't have any issues, should probably have an eye exam in their mid 30s or early 40s. In their 40s, every 4 to 5 years is fine. In their 50s, maybe every 3 to 4 years is okay. Once you hit 60, maybe every other year. But once patients hit 65, they should be examined once a year because their risk factor of, what I refer to jokingly as the big three, cataracts, glaucoma, and macular degeneration increases as we get older. And Medicare, or usually even their private insurance, will cover a complete eye exam with an ophthalmologist annually. And if many of these things are caught early, a lot of it is reversible and some of them is even preventable.
Okay. So get away from the idea that no news is good news. You need the news.
Correct.
You need to know what's going on because then you can take the measures to stay well and keep that vision in the best shape it can possibly be.
Being well educated about our health does nothing but benefit us in the future. That can be your high blood pressure, your cholesterol, your diabetes, whatever it may be, even your eyes especially. Being more educated does nothing but make your health better and your process of prevention better.
And most of us, I think, are more aware of our health at this time of life than maybe previous generations, where there isn't just that, oh, well, we get old and everything falls apart kind of attitude. There's a lot more emphasis on prevention now and on being educated. Talk, if you will, some about glaucoma.
Yes. So glaucoma, which rounds out kind of the big three, I tell patients sometimes is like high blood pressure. Patients can walk around with glaucoma for years and not know it and not have a problem and not recognize it. But it slowly chips away and degrades their vision. Macular degeneration affects your central line of sight. So patients lose their vision centrally, where glaucoma affects their peripheral vision, their vision out to the side. So they may have significant glaucoma in one eye, but not the other, but they never know it because we walk around with our two eyes open. Unless you kind of cover one eye at a time, Robin, patients won't recognize it. There's no pain, there's no discomfort. And so it's not unusual. Somebody at 62 will walk into my office and they come in with a pressure of 35 in one eye and 18 in the other and have significant visual field loss. And I say, oh, you, Mr. Johnson, you've got glaucoma. Well, what's glaucoma? And we talk about it. And it's a condition usually or often with patients equated with high eye pressure. But I tell patients you can have a pressure of 25 and not have glaucoma, and a pressure of 15 and have it. So glaucoma is very sneaky because it's a quiet condition, doesn't usually affect us, or we notice it till it's end stage, and we don't know that we have it. And so you can walk around again for years or decades with it and not recognize it unless you're going to an eye doctor. And what it does is it creates a slow degradation, not weeks to months, but months to years in the health of what's called the optic nerve. Now, we talked about the lens being the focusing mechanism of images coming into our eye, the retina being the film that processes that image. Look at the optic nerve where glaucoma affects it as the electrical cord that transmits that image from our eye to our brain. Our visual cortex is in the back of our head. And so those images get transferred to our eye, to our visual cortex, and that cable or electrical cord gets damaged. So those images don't get transferred properly, and it damages the peripheral vision for patients. So patients may come in their 20/20, Robin, but they're legally blind because they've got tunnel vision. They can only see 20 degrees and they can't see around them. So glaucoma is very sneaky. For example, the Tri-Counties, glaucoma tends to be more common in Hispanics, African Americans, and certain other European descents. And so these are patients who should be examined annually, probably after the age of 55 or 60, or if you have a family history of glaucoma, really at 40, because there's certain testings that we can do to manage that. So what does that mean? And these are simple tests. Eye pressure is the first thing. And often patients can go to global centers or See International, the Lion's Eyesight, even some larger clinics will do mass glaucoma clinics where patients come in, they'll get an air puff or a tono pen to the eye to check their pressure. I usually tell patients these clinics are okay as a mass kind of measurement of pressures for screening large populations, but they're not specific. And so even though that's okay, that doesn't take the place of your glaucoma test. So you really need to see an ophthalmologist or an optometrist if you're younger to have your pressure checked. But pressure is one factor. The appearance of your optic nerve is another factor. And then other scanning tests that we do, Robin, visual fields, which are tests where patients click a little button when they see a light flash to check their peripheral vision, as well as what we call an OCT or a scan of their nerve. Look at this as a fine CT scan that we do of the back of the eye and the optic nerve that can denote fine microscopic changes, Robin, of the optic nerve if patients are developing glaucoma. So really over a 6 months or a 1 year time period, we can see if the nerve is changing. And the nerve with glaucoma, Robin, is going to show changes on some of these tests before these patients recognize visual changes. And so if they come in and they're tested and they're monitored, we can often pick that up slowly. Oh, Mr. Johnson, look, you're not having vision changes yet, but all of your measurements are showing and you're tracking to early signs of open angle, narrow angle, normal tension glaucoma. So I'm going to go ahead and start you on a drop. Now, the benefit in today's world versus 25 years ago when I started treating patients is back then we had 3 or 4 medications for treating. All of them created a lot of side effects, irritation, redness to the eye, tiny pupils. It was hard for patients to see. We now have multiple different families of medications, as well as lasers and surgical options for treating patients, which are non-invasive, and have very little systemic side effects. So patients may be on drops for years, but don't notice it, don't know it. And these medications, Robin, are very effective. And so the key with glaucoma, it, like macular degeneration, tends to be slowly progressive, but we want that decline to be 2 to 3% per year, not 10 to 15% per year, right? And so often in today's market, if caught early and treated early, it's like prostate cancer for men. Men might get diagnosed with prostate cancer, but we normally outlive it and we die of natural causes of other things. Men don't die of prostate cancer anymore. And glaucoma is the same way. If treated properly, most of these patients maintain good functional vision for driving, reading, and working, as long as they're managed closely. But, they need to be managed every 3 to 6 months, testing and stuff like that. So it is a lot of visits for patients, but the medications and the treatments we have for patients is extremely effective. But this, unlike macular degeneration or cataracts, patients often don't know they have a problem. And so coming in and being screened early, even if they're just 40, just going in for an eye check and a vision check and a pressure check is often adequate for them. But if they have a family history, they need to be screened more frequently.
Okay, so in general, then, we just need to be aware. We need to keep an eye on what our eyes are doing.
Yes.
Because we're not always going to pick, I have my own little story. I was getting new glasses because mine were scratched.
Right.
And I was told that there was a tear in the retina in both my eyes, and one of them had to be repaired. The repair was so simple. It was this laser surgery.
Yeah.
I mean, it was over in seconds, no feeling at all, nothing, but it scarred that little place in the tear and
Correct.
closed it up. And the other one they've just kept an eye on for years now, and nothing has happened. But I had no idea. And I remember being asked, did you have a fall? And I had been bucked off a horse and did kind of a belly flop on my back. Very, very hard. And probably that's what did it. I don't know. I mean, I couldn't know. But how lovely that somebody made me aware of the fact that this needed to be taken care of. I had no idea.
Yeah. And these two, you bring that up. We didn't really talk about retinal tears and detachments, but that's something when patients, for example, come in just for their routine eye exams and get dilated. And often patients will go into an optometric practice. These are optometrists who basically do contacts and glasses. They'll offer, Mrs. Johnson, I can do a fundus photograph for you and look at your retina. Now, the fundus photographs, undilated, are okay to rule out large tumors, significant macular degeneration, large retinal tears or detachments, but it's not adequate for picking up micro tears, small tears that patients can have, Robin. And that's where they really need to see an ophthalmologist to be dilated. And we look at their peripheral retina through what's called an indirect ophthalmoscope in a 3-dimensional lens, and we can get a better depth of exposure. And yes, if these tears are caught early, there's very, very effective treatment for these tears, which is a laser, which routinely is not uncomfortable. I tell people it's kind of like tacking down a little tear of your wallpaper on the wall to keep it from expanding. But patients, all of us kind of in our late 30s to early 50s develop what's called a posterior vitreous separation, where the jelly cavity in the center part of the eye starts to liquefy and separates. When that occurs, patients can get little flickers or flashes of light, and that's when we get what we call floaters, our friends, these little spots, gnats, or cobwebs that we see moving out of our line of sight. Um, at that time of our life, we can develop a little retinal hole or a tear, which, if gone untreated, may progress to a retinal detachment. Now, that can happen again later as we get older, that in our late 50s to mid to upper 60s, that vitreous continues to liquefy and will separate. I tell people it's kind of like removing the walls of a building. Sooner or later, you remove all those inner walls and the outer walls collapse in on itself. The same thing happens in the vitreous gel. The center starts to liquefy. It gets to a point where the outer, more gelatinous structure can't withstand and it collapses in. As it does that, it peels away from the retina, and in doing so can take a little piece of that tissue, Robin, with it when we're older and create a new tear. And if fluid gets under that tear, Robin, that develops into a retinal detachment. When that occurs, what people will see will be a dark curtain or veil coming across their line of sight, like a dark shadow or shade. That's actually more of a surgical emergency, in which case people need to come in and see an ophthalmologist immediately to be checked. And if they have a detachment, then they're referred over to the retina surgeons. But again, in today's market, retinal detachments are very effectively treated. And if treated early, most of these patients maintain good functional vision moving forward. They often develop a little bit of a cataract from that type of surgery, which then I'll go in and remove for them 3 to 6 months later, but they'll maintain good functional vision as opposed to them waiting at home and saying, this is not getting any better. They come in a week later. Well, now the detachment is much more progressed and their long-term recovery and recovery for good visual recovery is very low, unfortunately.
Okay. So lots and lots of good news if we stay on top of things. Lots of treatments, lots of hope for maintaining great vision.
Yes.
Way beyond being a person of age. Just, we get to keep it if
Correct.
we pay attention to it. So just before we finish today, Dr. Pavloff, I want to thank you for all this wonderful information.
Oh, you're very welcome.
We need to be alerted that
yes,
this is our job, to stay on top of this, to keep having exams, to maintain our health at every level in our body. I want to ask you just a couple of questions that are more personal before we stop. So how about telling me what you feel is your greatest accomplishment in this lifetime so far?
I think what my greatest, I've been very blessed, Robin, in my life. I love what I do. It's always come easy to me. It's kind of weird, but I kind of felt like I've done it before in another lifetime at some point. And I never had any eye issues growing up as a kid. So I think besides my children and my family, which I really adore and cherish, I think traveling internationally and doing cataract surgery in third world countries and being able to offer patients who these are not patients who are old, they get cataracts early, they can't work anymore, or they can't see their kids or their family. Younger people in the family structure have to take care of the grandparents then. And being able to transfer internationally, whether it's South America, Africa, Asia, and doing surgery and restoring sight to these patients through C International, and giving them their life back and their ability to kind of help in the family structure, I think for me it is probably one of my greatest accomplishments in my life, and certainly one of the things that brings me the most joy in what I do, being blessed to work in this community and do cataract surgery.
It makes so much sense. I do so believe that the most rewarding thing we can do is be of service in the world. And with the skills that you have, what an incredibly valuable service. So as we close, Dr. Pavloff, I want to ask you what you want to say to other persons of age.
Sure.
What's your message?
Well, one thing, I want to add one more comment about the cataract world, because everyone's afraid of having cataract surgery, Robin. They've all heard friends who have had surgery and had a disaster or something comes up. I just want people to feel and know in today's market, with the advent of laser assisted cataract surgery, with the advent of new lenses that we can use, there's 10,000 baby boomers a day turning 65. And people are living longer, they're healthier, they're in shows like this or podcasts like this, people are taking better care of their health. And so people want to see better. So there's a lot of different lenses out there that are on the market now that help people see far away, read up close, do their computer work, and be eyeglass free. But I want people to understand that the procedure in today's market is very, very, very safe. When done properly, when done right, is an exceptional thing to have done, and really adds to their quality of life as opposed to taking away from their quality of life. So what I would tell people is they don't need to be afraid of having cataract surgery. Their grandmother, their mother had an issue, but the technology that we have in today's world compared to what I started doing 25 to 30 years ago is so much more advanced and so much safer that I just want your people who watch your podcast and show to know that this is a very safe thing to have done, and people should not be afraid of it. I think my biggest message, and this is something that I share with my patients really every day, is age is, at least in my opinion, is really just a number. It's a physical number. In today's world, we're all, again, living longer, we're healthier, we're taking better care of ourselves. So I don't want people to get hung up on their age. I'm 62, I'm 65, I'm 75, I'm 82, I'm 85. Really, it's a state of mind. For those of us who mentally stay younger, mentally stay healthier, and take care of our bodies, we are going to age better, we're going to live longer, we're going to be healthier, but that will create a better state of emotional health and physical health for us. And I think that's the most important things that most people need to kind of take in these days. My world is seniors. I see people all the time who are getting older, from attorneys, doctors, professors from UCSB to migrant workers. And the book is all the same. For those people who stay active, stay engaged, stay busy, stay moving, and keep themselves mentally active, that could be Sudoku or whatever they do, crossword puzzles, they live longer, they're healthier, and they're happier. For those patients who take on a more sedentary lifestyle, their eyes, their body, their health goes down quicker, and I see mental changes in them a lot sooner than I would expect to see for people who are very intelligent in their lives, engineers, architects, whatever it may be. So I would just tell your clientele and your fans and the people who watch your podcast, staying engaged in the world, staying active, and living a healthier lifestyle will keep them more engaged for a longer period of time. Yeah.
That's what we all need to be aware of, that
Yes.
we keep moving on every level, mentally, physically, emotionally, spiritually.
Yeah.
And
that moving doesn't have to be running 20 minutes, right, Robin? I mean, just moving and being engaged with the world around you and your friends and your family.
Yeah. And enjoying life. That is so important too.
Yeah, correct.
Dr. Pavloff, thank you so very much for all the information you've given us and for that nudge. Take care of yourself. That's what I hear you saying. Take care of yourself. And thank you all for being with us today. We'll see you next time. Bye.
Thank you, Robin.
Thank you. Sensationally Silver, A State of Mind, is sponsored by Sensationally Silver, a complete hair care product line created especially for people with hair like ours, naturally gray and white hair. Sensationally Silver products can be found exclusively at sensationallysilver.com.
Sensationally silver.